going to get people's attention so we can get started here in a minute or two. Isn't it crazy?
It's so much
Can't say
easier
I've seen
in
that
my
before,
hand.
yeah. My wife told me to smile, and I said, this is a serious subject, so we'll see how that goes.
Somebody needs to adjust that audio, or we're going to have feedback.
Are we ready? Good morning. My name is Tony Kenobi, and I'm the chairman of the Scott County Board of Supervisors. The Quad City Health Professionals, Scott and Rock Island County Health Departments, our hospital systems, Genesis and Unity Point, community health care, our emergency management officials from both counties, Medic EMS, and the Bi-State Regional Commission, along with our partners, the elected officials in all 15 cities that make up the Quad Cities, our Chamber of Commerce, Visit Quad Cities, and recent additions of Community Foundation and the RDA, who have stepped up to the plate as well, have met over the past week to assess, debate, and to recommend best practices for our community in its response to the COVID-19 outbreak around the globe. We're here this morning to share those thoughts with you and to ask your help in disseminating this information clearly, consistently, and in as concise a manner as is practical in such a situation. We all understand that the decisions we recommend will be difficult. Long-planned events will be canceled. Important family events will be set aside. People and businesses will suffer financially. I can say this from personal experience. I shut down an event yesterday that was about to bring 3,500 people to our town. Tremendous financial impact. I'd also love to go visit my mom in the nursing home. These are real factors that affect us all. At the heart of these recommended actions is an effort to slow the spread of this disease. If we're successful in that endeavor, our health professionals will have adequate capacity to care for those affected by the inevitable spread of COVID-19 to our community. Joining me first to talk about this subject this morning is Nita Ludwig, who is the administrator of the Rock Island County Health Department. Nita?
Thank you. So I'm Nita Ludwig, Administrator of Rock Island County Health Department, and I would like to share the idea of flattening the curve with you today. Because this is a new virus that no one has any immunity to, we do expect cases in the Quad Cities. We could possibly see a large number of cases. Flattening the curve refers to the way in which pandemics affect the healthcare system. It's a method of slowing down quickly rising case counts. So as you can see by the slide that's on the screen, that is the typical curve that happens with a pandemic. If you can see the sudden spike, that's when a lot of people get sick all at once and all go to the doctors, clinics, and hospital systems. And these systems also become overwhelmed with numbers of patients and they could run low on supplies needed to care for the people. If we can reduce the number of people exposed in these large events and gatherings, fewer people will be likely to become ill all at once. The idea to flatten out those numbers, which is basically the yellowish curve there, to flatten it out, that not everyone needs to go to the doctor all at once. If we can stretch or flatten out the time period, doctors and hospitals can maintain their supplies better to care for those who really need them, and then they will be more able to care for the large numbers of patients in a more manageable way. The overall result would be fewer people infected and fewer deaths, as noted by Dr. Anthony Fauci with the National Institute of Allergy and Infectious Diseases. This has been shown to work and was a method used in China, after which the cases have declined. Recommendations on how to go about flattening that curve will now be reviewed by Mr. Ed Rivers from the Scott County Health Department.
There are no known cases of COVID-19 in the Quad Cities at this time. However, it's likely that there will be. So the COVID-19 Coalition has a set of recommendations to help flatten the curve and prevent overwhelming our medical resources. Our first recommendation is consider avoiding social gatherings or community events where you cannot maintain a 6-foot distance between yourself and others. Organizations are encouraged to postpone social gatherings or community events of 250 people or more. If you're an organizer of such an event and you have not taken this step, we strongly urge you to do so now. If you have COVID symptoms, fever, cough, shortness of breath, please call ahead to your medical provider or walk-in clinic. Please do not just show up to your medical provider, walk-in clinic, or emergency room. They'll want to prepare for your arrival to protect others in the facility. Stay home if you're sick. Please don't go out and expose others. We're encouraging local employers to implement flexible sick leave policies to accommodate you if you are sick. If you're considering travel, monitor the spread of COVID-19 at your destination and along your route. If COVID-19 is spreading at your destination, you may be at higher risk of exposure if you travel there. We also have a set of recommendations for individuals to help you protect yourself against this disease. You've probably heard them before, but we cannot emphasize them often enough. Clean your hands often. Wash your hands. I'll say that again. Wash your hands. It's your first line of defense against this disease. Avoid close contact with other individuals. Stay home if you're sick. Cover your coughs and sneezes. Clean and disinfect. Think about doorknobs, light switches, tabletops, chair arms, those things in your environment that you routinely touch and others perhaps touch. Make sure you have sufficient medical supplies if you require them. An additional note, older adults and those with chronic diseases are particularly susceptible to this disease, and this is especially important if you're planning travel. Take that into account if you're planning on traveling either within the United States or elsewhere. We thank you for listening to our recommendations. We hope you will implement them, and we hope that we'll be successful in flattening the curve and making sure our medical professionals have sufficient resources to handle their response. Thank you.
Good morning. My name is Lisa Caffrey. I'm Infection Prevention Coordinator at Genesis Health System. And I just want to share with you a little bit about what our health system is doing to prepare for this. We have been preparing for several weeks now. We are closely monitoring the situation and following the CDC guidelines for hospitals, as well as the guidance from our public health partners. And the things that you can do to help us be ready is, number one, follow our recommendations on visitor restrictions. It is really important that we minimize the number of people in our facilities. And we have our signs are posted, and we would really appreciate it if you followed those. Secondly, as was mentioned earlier, call before you're coming in to see somebody if you think you have COVID-19. We want to be able to protect everybody, including our healthcare workers, and have the appropriate masks or whatever are needed available. If you are tested at our facility or any other facility and you are told to stay home, that means you stay home until that test result is back. You cannot go to the mall, go to church, whatever it is you want to do, you need to stay home until you know the result of your test. That way we can protect the community and others. We are working diligently with our staff to be sure they're comfortable with the isolation precautions that are recommended and the equipment needed for caring for the patient with COVID-19. We just really is so important that you listen to what your healthcare provider is telling you, what our public health departments are telling you, so that you can protect yourself and be prepared for whatever is to come. Thank you.
Good morning. I'm Angel Mueller, Director of Quality and Infection Prevention at Unity Point Health Trinity. Our mission at Unity Point Health is to improve the health of the people in the communities we serve. And there's truly no more important time than this in which we continue to work our hardest to do so. I also want to reiterate how important it is for all of you to help us slow the potential spread of COVID-19 in our community. Unity Point Health has had plans in place for many years to respond to the potential spread of infectious disease. We are also continuously monitoring and implementing the guidance provided by the World Health Organization, the CDC, and our state and local departments of public health. As a health system with a span of 3 states, we are also holding multiple meetings daily, and we are prepared. For those who are ill and need to seek medical care, we also ask that you please call ahead to your primary care provider or a walk-in clinic for care if needed, to let them know that you are coming in and that you have signs and symptoms consistent with COVID-19, and please follow their direction. We have testing supplies and will follow the guidance of and work with our departments of public health to determine if testing is recommended. Along with Genesis, Unity Point Health has also implemented visitor restrictions within our facilities, and we ask that you please comply with these to protect our most vulnerable patients. We need the help of our communities to ensure that our healthcare resources allow us to continue providing the best care possible. And you can help to reduce and potentially prevent the spread of COVID-19 by following the recommendations that we have provided today. Most importantly, now is the time to stay calm, stay informed, be kind to one another, and respect the health concerns of our community. If we all do this together, we can all make a difference for everyone. Thank you.
Good morning. I'm Sherry Huff. I am the Director of Quality with Community Health Care. We're an outpatient primary care clinic here in the Quad Cities. And just wanted to reiterate that we are also prepared. We've like Unity Point and Genesis, have had plans in place for something like this for many years and have been watching this particular situation closely. We are also following guidance from the CDC and from the local public health departments in the state. And so our ask to you is that if you need primary care and screening, we ask also that you call ahead to our clinics. And I think that's, if you can take one message away today, that is certainly a strong one. Know that screening is based on symptoms and recommendations from the public health departments. And so we'll do our very best with that. Please know that when you do call ahead, there will be some additional screening questions, and so we just ask for your patience as we proceed with this. All of that is in the very best interest of you and our community to make sure that we're providing care as safely and effectively as we can.
Good morning. I'm Paul Rumler, CEO and President of the Quad Cities Chamber. Here in the Quad Cities, we think as a region, we plan as a region, and we act as a region. And I think it's worthy of noting and the importance of today and of who all convened. Look around the room, we have most of our elected officials, we have our health departments, we have our health systems, and we have many community partners that are too many to mention. This is a very important day for the Quad Cities to provide clarity and direction for our region. And I want to thank everybody here today for doing that in some very uncertain times when our residents and businesses are looking for as much information as possible. The states have yet to, both Iowa and Illinois, make consistent recommendations, but we can rest assured that the Quad Cities region has made consistent recommendations that you've heard today. Many organizations have made some very difficult decisions nationally, regionally, and here locally. Those were not made lightly, and we know that those are going to impact our daily lives. I want to reinforce the need for all Quad citizens to help mitigate the local impacts, to help make sure that we deploy resources to the best of our region's ability. COVID will cause business interruptions, and as well as adjusting our residents' lives. I ask all of our region's businesses to follow the recommendations and guidance from the local officials you've heard from today, as well as our state and federal officials, and determine the best course of action for your business. I've talked to many, and our team members have talked to many businesses around the region, and I know that they're already taking action. For example, this recommendation might hit some of our retail and restaurant and service businesses more greatly, and so we want to make sure that residents understand that they can still frequent those establishments. Some might have curbside services, for example, or delivery, to make sure that you can still maintain that personal space to keep you safe. The Chamber will continue to be a resource during these volatile economic times. As businesses need help and assistance or seek information on what they can do, the Chamber on our website has best practices available for all businesses to consider, so that way we can minimize the local economic impact as we wage through this health crisis, and we ask everybody to help us sustain operations during this difficult period of time. Thank you very much. And I think I'm last, unless Tony, you have some recap.
We'll take questions now. I would ask the health professionals to join me up here, since they're the ones who are going to be able to answer the questions. And we'll start right here.
Sure. So a lot of, I'm sorry. As you know, a lot of places have started nationally canceling different events, such as the NBA season, the NCAA tournament, things like that. And we knew that in our area that was going to be affecting us as well. And we have a great group of people. We formed this Quad City COVID Coalition, and we decided it was time to meet with all these various partners. Now we have the businesses and the elected officials joining in this effort. And so it was time to start making some recommendations to businesses. We were getting calls and questions, and we just thought the timing was right to give the public our best recommendations for those.
How many Quad Cities have been tested? And how?
It's difficult to know that number.
Why?
The Iowa Department of Public Health has allowed hospitals to make their own, do their own tests. The only ones that we would be aware of are those reported to us from the Iowa Department of Public Health. It is a small number. I don't have that exact
Would you
number.
please make your remarks
At this
to
podium?
the podium so that everyone who's listening live and we're recording so we can understand?
Maybe the hospital representatives can answer that question. Do you know how many Quad Cities have been tested at your facilities?
No, we don't.
You don't know?
For the reasons Ed cited.
What's the availability of local testing kits?
So the testing is done, Angel can help me with this. We can test people here, but the specimens have to be sent either to our state hygienic labs, either in Iowa or Illinois, depending upon your residence. And if we're using a commercial lab, they will be sent to another lab location, perhaps in North Carolina. So we can test people, we can get your sample, it gets sent out then to another lab, and then we wait for those results to return.
And how long are those results taking?
It depends on where it goes and the timing of everything. It takes about 24, 48 hours depending upon where it goes, maybe a little bit longer. Keep in mind, this is happening across the country, so these labs are they're working really hard to get those test results turned around, so it could be a little longer than that.
Can anybody come and get tested, or is there priority for,
Do you want to do that?
Sure.
I mean,
Let's also repeat the question so that people at home can hear the question.
Sure. Can anyone get tested at this time? And that answer is really no. According to the Illinois Department of Public Health, and I'm sure Ed can speak to the Iowa recommendations, but it's really those that have been in contact with a known case, that have traveled somewhere, that there's an affected area, or if they test negative for influenza, because that's very prevalent and shows kind of the same symptomology. If they test negative for the flu and they test negative for strep, and they're still having symptoms and the cause is unknown, then they would be recommended for testing. There's also private physicians who now can order testing through a private lab. That's starting to become more available. And so, you know, it's up to the physician's judgment on those folks. And I don't know if Ed would want to elaborate any more.
As I noted, the Iowa Department of Public Health yesterday issued advice that hospitals and physicians could begin to test independently of the state system. The Iowa Department of Public Health will still require that their department approve tests that go through the state hygienic lab. Also, our medical director, Dr. Katz, indicates that the worried well may want testing. But since there's a shortage of test kits, a limited supply of them, the health facilities will require that, as Nita pointed out, certain symptoms and situations be present before they will test.
I think the reason we don't know how many tests people have been tested, sorry.
I'm just not up to speed on the number that have been reported to us.
And what recommendations are the health department giving to schools?
We're consulting with schools. We're having a joint meeting with the 4 superintendents this afternoon to develop strategies for them. Their prerogatives are different, say, from universities. If you cancel schools through K-12, you're also affecting the workplace, pulling people out of the workforce. So we'll be consulting with them this afternoon. Fortunately, spring break is next week for many of them, so it's not as pressing an issue. We have some time to plan, and we'll be working on strategies with them.
When will the hospitals disclose the number of tests that have been completed and when kits will be available?
well, kits are available.
Yes,
Go ahead.
kits are available, and we're currently able to test. And it is difficult, especially when we both have facilities on both sides of the river. So,
Can you speak for your facility alone when you'll disclose
Yes.
how many tests?
well, I'm not certain if it's necessary to report exactly how many tests we have run. Obviously, when we have positive tests in the area, that's when the departments of public health will speak out about those results.
Well, given that you have to qualify, so to speak, to be tested, that would seem like an important number, would it not?
It's important to know who may be at risk, and that's why we have screening in place to identify those patients and test. But there's a number of other reasons that patients could be ill right now. We have a lot of influenza circulating in the community, strep, other respiratory illnesses that are causing those infections also right now.
Right, but I thought you said if you tested negative for influenza and or strep, you then would qualify to be tested for COVID-19.
That's just one of the criteria.
One of the criteria.
Yeah, there's other criteria as well. So it's a very difficult algorithm on both sides of the river for both states. So it's not as black and white and cut and dry.
Maybe you could tell us what are the reporting requirements?
So we don't
Even
have,
for influenza A, you have to report positive tests,
no,
right?
no.
Nope.
No?
Influenza, in Iowa, I'll speak for Iowa because Illinois is a little bit different. Influenza is not a reportable illness in Iowa, so
But COVID-19 is.
COVID-19 is, and our lab partners will be doing some of that reporting. So the lab is keeping track of this stuff, and they'll be reporting it to our public health departments.
The positive results
The positive
are reported.
results, yeah. Positives are reporting.
And then influenza is reportable, but it's in Illinois
In
under
Illinois,
certain
it's different.
conditions, ICU admissions, issues like that.
I heard Trinity, I believe, say you're not going to disclose. How about Genesis? Are you going to disclose the amount of testing you're doing?
I don't know that at this time we'll disclose that information. I can ask when I get back up there, but we don't normally do that. We would probably work with our public health. Well, but we would we're partnering with our public health. The message is that, as Ed, I think, said, that, you know, it's likely that there's probably some in this community. We just don't know how many cases are out there. When it happens, public health will tell you when there's a positive case. But what we were trying to get to is that.
Yeah.
That's our point today.
The connection between public health just told us they don't know and don't know how to get it.
What do you mean?
Dr. Irv just said.
That's it.
They'll be aware of the
They know about
positive.
the
We'll let them
positive
speak to what they
results,
will
yeah.
do for the positive results.
The Iowa Department of Public Health has a website that you can go to see the number of tests performed by the state hygienic lab, the number that are positive, and the number that are negative. What I said was that personally I was not up to speed this morning on the number of tests performed in Scott County from that number at the state hygienic lab, and I don't want to misspeak.
So will the public ever know how many testing is done in this county?
I'll have to get back with you on that question.
Could I just add a little bit there? So the Illinois website, Illinois Department of Public Health, does have total numbers tested in Illinois. It's not broken down to the local levels at this time. We do also expect in the coming days and weeks that there will be more supplies of test kits to these labs, both the commercial labs and the state labs, which we have 3 in Illinois, Chicago, Springfield, and Carbondale. So we do expect that to ramp up. There's going to be lots of people that will probably be tested in the near future. So those numbers are going to hopefully rapidly become increasing, and the system will be much more robust than it is today. I think you've heard that all across the country, that there's not as many test kits as we would like for those laboratories, but we keep getting reassured by CDC and other officials that those test kits are coming. I do know there are several private companies that are also working on rapid tests, so you know that might be something that comes down the future too. This is just a rapidly evolving situation, and we don't know exactly how it's going to pan out at this time.
What are the hospital systems doing now to prepare for a situation where we would have a lot of mistakes? Are we preferring surgeries or other things now, or?
We do. Both of us have surge plans should we have an influx of potentially infectious patients or patients with COVID-19. And so a lot of things we would review. And you know, it would depend on the level of the situation we're at in our community. As you know, it increases, we would maybe potentially put additional things into place. But anything like that could be reviewed if necessary.
But specifically, what steps are you taking now to prepare?
Well, we have pulled out our surge plans and you know, are educating on those, reviewing those, determining at what point we may need to enact some of those mitigation efforts.
What are those mitigation efforts look like?
So obviously you mentioned one as a potential, and not saying that you know we would do that anytime soon, but it's something to think about. Would we need to potentially delay elective procedures? That way we have more bed availability. So that's definitely one potential option.
But right now it's business as usual?
It's business as
Yes.
usual.
Yep.
We're monitoring the situation carefully. We have plans in place that if we have to go to that extreme, we have staffing plans in place that we can tap into if we need to go there. So we have all of our plans. We're just, you know, waiting to see how the situation unfolds and what we need to do.
How long will it take until we know whether we flatten the curve?
We'd like me to talk to that one.
I don't know. I think that really is an unknown at this time about how long to flatten. But the idea being, even if it's the same number of people that will be infected during the course of this whole pandemic, if you can stretch it out and not send everybody to these healthcare systems at the same time, that it's more manageable. They'll be able to resupply their stocks of what they need at the hospitals and healthcare systems.
That dotted line, how many very sick people hospitals can treat, what's that number locally?
Can you repeat that?
The dotted line on the graph, how many
Yeah.
very sick people hospitals can treat, what is that number locally?
So we have projections all lined out there that we're working on. And that's how we're working through our surge plan, taking models using our worst flu season, and then thinking about how much worse this season could be based on what we're seeing in Seattle and other parts of the country. So we have capacity. We have some capacity, but we will hit our limit at some point. We're still trying to work through that to see exactly what that number will be, but we are working towards that.
How many hospital beds are there in the Quad Cities?
I don't know that answer.
Not off the top of my head. It'd take a little time and a little math.
So you can do the math.
So, for the Davenport campus, I don't want to give you wrong numbers. And do you know?
You're licensed for a certain number of
Well,
beds.
but we have to remember we have hospitals in multiple cities. So our Davenport campus is licensed for 502 beds. I can't answer for Silva's. Our critical access hospitals are a little bit smaller.
Those are probably on the websites, aren't they?
Yeah.
Yeah.
Licensure
Yeah. I know Davenport's 502. Silva's is considerably less than that, and our critical access hospitals are even less than that.
There's one private hospital here in the Quad Cities too.
Select, yeah. And I can't speak for them at all.
So there are 45 or 50 of us here in pretty close quarters. Is this an endorsement? Is this an okay size?
It's under 250.
Right
so,
now, it's under 250.
Yeah. So the recommendation is 250. We'd certainly prefer everybody to have a little space between each other and to practice good hygiene, use your sanitizer, wash your hands. I'll say that again. So.
We have a lot of good questions. I have one unscheduled agenda item. I want to introduce Kirby Wynn from the Blood Center to make a few comments.
Hi, Kirby Wynn, Mississippi Valley Regional Blood Center. Our own Dr. Louis Katz has been very active and involved in local response. Could not come this morning, however, because he's involved in so many different meetings, including on a national level. Our message from the blood industry is we want you to know there is an impact. Social distancing, class cancellation, schools closing, employers asking people to work from home has an impact on the blood supply. And it's been very, very serious in Washington State. We responded to a request last weekend to ship blood to Seattle, to BloodWorks Northwest, and we're able to do that. It was a small package of components, and blood centers around the country did the same to support their need. As we see increased calls for social distancing and changes to the calendar, we are seeing now canceled blood drives on our agenda, and we must replace those donations. It's very serious for the blood industry because a patient who needs a blood transfusion can't wait. They won't need a blood transfusion in connection with COVID-19. They'll need it for cancer treatment, surgery, or complications in connection with childbirth. So many different reasons that really they cannot be delayed. And so our message is really it should be a silver lining in all of this. We're a place, Mississippi Valley Regional Blood Center is the provider of all the blood components transfused at our local hospitals, and so the difference that healthcare is making for folks in our community in all the various reasons that blood might be needed, people can help by coming out to give blood. So I'll just close with our web address. It's very simple, bloodcenter.org, and thank you very much for the opportunity.
All right, I'm going to wrap up the official part of the press conference. Thank you very much. This is going to be it. Want to recognize that this coalition will continue to meet and will provide updates on a regular basis as more information comes available. So thank you very much. There will be, that's not my area of expertise. Brooke?
We're meeting after this to determine that, and so we'll be able to share that with you.
Yep.
Great. As
Thanks.
this progresses, can we have these briefings again?
I believe that as needed, yes, we will. Thank you.
Thank you all.